Very good morning, people. Hope mmekuwa na siku poa and your day has started well. Tuko hapa, as I promised you yesterday, tunaongelea mambo ya health, and today we want to talk about your dental health. Sawa sawa, ama oral health. And of course sitaongea peke yangu. Zile maswali mnakuaga nazo mingi, nasikiaga dawa ya meno ni kungoa. Today we have daktari hapa atupeleke na rada kuhusu hizo maswali zote mnakuaga nazo. So what you do before tuendelee, if you have any question about your teeth ama kuna issue tuna mdomo yako, this is your opportunity right now. Tuandike SMS kwenye 22422 #daybreak kutupeleka na rada @Citizen TV Kenya pale Twitter. We will read your questions. Daktari atajaribu kujibu as many as we can. You know, I posted this poster and in 1 minute I had like 50 questions. So what we will do, we'll try to answer as many questions as we can on the issue that we are addressing today. Sindio? And of course nimewambia niko na daktari. Anaitwa Dr.Muriuki PJ. Dental surgeon. Ako na title. In fact, wacha mwenyewe ajiintroduce, aseme title zake vile zinafaa. Daktari, how are you?
Very well, Chata.
Huko mzima leo?
Kabisa.
All right.
It's good to be here.
Yes.
Thank you very much for the invite. And like you said, my name is Dr. Muriuki PJ. I'm a dental surgeon by profession. A very passionate dentist.
Okay.
Other than that, I also serve in different capacities. I am the organizing secretary of the Doctors Union in Nairobi. And I also serve in the National Governing Council for the Kenya Dental Association. So Kenya Dental Association is the premier organization that deals with all matters dentistry in the whole country.
All right.
Yes.
That's very good, because you will answer a question I've always had, that why do insurance companies separate dental issues from normal issues or diseases?
Yeah.
But let's start with an introduction to what you would call oral health. What would you say that is, and what is dental health?
Okay. So oral health is basically the health of your mouth, all right? And like we say, the mouth is a window of the body. And therefore, if your mouth is healthy, it is a precursor to how your body is. If you have poor oral health, that means you have problems with your teeth, you have problems with your gum or the other tissues that are in the mouth, then you cannot have good health of the body, because digestion starts from the mouth. That is where you take your food. So therefore, if you have a problem with your mouth, then it is a precursor of what will happen to the rest of your body. So therefore, it is important for us to have very good oral health.
All right.
Yes.
When you say to have very good oral health,
yes,
you will break it down. Today we said we are demystifying these things. So you will break it down to us what it entails to have a good oral health.
All right.
And good oral, would I say manners?
Yes.
You know?
Yes.
You know, most people will go to hospital when they have a toothache.
Yes.
Is when they'll be like, yo, I need to go see a dentist.
Yeah.
You know? What would you say is the right time that someone needs to start seeing a dentist? Do you wait until you have a toothache, or should you just do it as a normal checkup? All
right. So that's a very good question. And actually we call it oral health seeking behavior. It is very important because, especially in our country, you find that most people, like you said, run to the dentist when they're in pain, which is wrong. You are supposed to visit your dentist at least once or twice a year, even if you don't have a problem. Because dental problems or oral health problems don't just start in a day, okay? It is a process. Yes. So you find that, for example, the most common dental problem is dental caries or cavities in the mouth. It is a process, and it does not happen in a day. So it means if you go to your dentist early, you are able to identify it early and have treatment done at the right time. Because, for example, I'll probably just try to explain the structure of a tooth.
All right.
All right?
Yes. And
with me here, I have a dummy. This is just a dummy of how the tooth looks like, right?
Yes.
So if you look at it, this is representing the gum.
Okay.
And this is the tooth as we see it in the mouth.
Yes.
So now, if you cut that section into two, this is how it looks on the inside.
Oh, okay.
So as you can see, a tooth has layers.
Okay.
All right? So this is the outer layer that we normally see. This is called the enamel.
All right.
All right?
Yes.
So the enamel is a very hard tissue, very, very hard, and it's not living. So it can't feel pain.
Ah.
All right? Then we have the middle layer here, which is called the dentine or dentine. You know, depends with where you come from.
And where you
yeah, exactly. Yeah. So this is the middle layer. So this one is usually, I'd say, semi-living.
All right.
So that it is able to feel some sensations. Okay. Hot, cold, you can be able to tell. Then we have the inner part of the tooth, which is called the pulp.
Okay.
So this is like the engine of the tooth. All right?
All right.
So the engine of the tooth, where you have the nerves, the arteries, the veins, basically the blood vessels are found inside here.
All right.
Now, when you develop a cavity, it starts from the outer layer. So you see, when it is starting on the outer layer, you don't even know that you have a cavity. Why? Because the outer layer is dead.
All right.
It does not feel any pain.
Okay.
So you will just stay at home thinking that you do not have a problem. But dental caries is a progressive disease. So it will continue going down these layers. So it reaches a point where now it gets to the dentine. When it gets to the dentine, that's when you start getting some awareness that there is something happening. You take something hot or cold, you feel there is something that is happening. Still not painful, but you feel the sensitivity.
Sensitivity.
Sasa, the moment now it gets to the center of the tooth, which is now we have the nerves and the blood vessels,
All right.
that's when you feel pain.
Okay.
And that is why we are saying it is important to go to the dentist because early. Because when the cavity is starting here, you will not know. But when you go get it checked, it will be seen, and then you can have a feeling done. But now when you wait until it gets to the nerve and you're in pain, that is when you have to do a root canal or you lose the tooth. Okay. So that tells you that it is very important to visit the dentist when you do not have a problem.
True.
So that some of these things can be identified early.
All right. You've mentioned about a root canal or removing the teeth.
Yes.
Or we will get to that.
Yes.
Because bado tunaanza.
Yes.
This is a set of teeth, yes?
Yes, yes.
And you're going to show me how to brush.
Yes, yes, yes.
But people wake up and brush their teeth normally. You know, it's a normal thing. Like you have your brush, you have your toothpaste, and you brush and you go.
Yeah.
But now you're telling me there's a specific way you should be doing it.
Yes.
You know?
Yes.
Do you demonstrate now or later?
Yes, we can, sure. I mean, that is the first thing that anyone should do about taking care of their teeth. And like you said, brushing is not just brushing. You know, there is a specific way you are supposed to brush, as you are going to demonstrate.
Yes.
And another thing is that you should brush at least twice in a day, at least. You know,
right.
And that brushing should happen after meals.
Okay.
The most important time for brushing is after dinner.
All right.
Okay, before you go to sleep. The reason being is. You know, at night, if you just eat and you go to sleep and you have food debris left in your mouth, at night you are not talking, you are not doing anything. So the mouth is just chilled, you know. And as we know, the mouth has a lot of bacteria. So that is when the bacteria will be having a party in the mouth. And that's when most of the damage happens.
True that.
So it is important that every person must brush before they go to sleep. It's really, really important.
All right.
So
that's news to a lot of people.
Yeah, actually,
That's
most
news.
people think. I know of people who even brush before eating.
Yes,
and that's
the question that I was coming to, because if you're saying we should brush after meals,
yes,
but when we wake up in the morning, when you go to take a shower, you brush your teeth.
Yeah.
You know, even in school we were told, when I wake up in the morning. So you brush before breakfast or after breakfast?
After breakfast, because why are you brushing?
But that's the opposite. Well, that's what we do. When you take a shower, you brush, then you sit down.
And that's why we are here to demystify some of those things, you know? Because some of those things are so ingrained in our society.
All right.
And that's why we are here to demystify some of those things. So brushing should be after meals.
Okay.
Right? So in the morning, you wake up, take your breakfast, then brush. In the evening, you take your dinner, and then you brush.
You brush.
Yes, before going to sleep. It should be the last thing you do before going to sleep. Yes, so that you sleep with your mouth clean.
The last thing you do is you leave the house?
Yes.
And the last thing?
You do before going to bed.
To bed.
Before retiring to bed, yes.
That's new. I hear you are saying something.
So, So here I have a model with me.
Yes.
So it is just a model of a mouth.
Okay.
The way a mouth looks like. Of course, this is an adult model.
All right.
With a full set of permanent teeth.
Okay.
So most people just brush the surface that is being seen by people.
Okay.
Because you don't want, when you smile, people are seeing that. So most people concentrate on brushing the outer side.
Okay.
But as you can see, teeth have different surfaces.
Okay.
So there is the outer surface, there is the inner surface, right? There is the biting surface, and there is the inner surface towards the tongue.
Okay.
Right?
Yes.
Then you also have the tongue here.
All right.
So how do you brush? First of all, you should use the proper brush.
Okay.
There are people who use a very hard brush, and that, as we are going to probably talk about it, can cause damage
Okay.
to the teeth and the gum. So you are supposed to use a medium brush, not very hard.
Okay.
Then the other thing is about the force. You are not scrubbing the floor. I mean, you are brushing your teeth.
Your teeth.
Right?
That's...
So there are people who brush their teeth. You can hear them from the sitting room and in the bathroom. You know,
True.
That is wrong. Number 3, it's about the technique. Which technique do you use for brushing?
All right.
So if I may just try to demonstrate.
Yes.
So with your brush like this, I know most people when you are starting brushing, they just do horizontal strokes like this.
Okay.
All right?
Yes.
So this is not recommended, doing,
But that's
like
the normal
exactly.
standard procedure.
That's why we are demystifying these things, right? So what you're supposed to do is you, of course, get your brush,
yes.
nice brush, medium, put your toothpaste.
Yes.
Toothpaste, you can use any, all right?
All right.
Then you can start from the back.
Okay.
The motion that we prefer
yes.
and we recommend as dentists is circular motions.
Okay.
All right? So you don't do like the way you polish your shoes.
All right.
So you just roll your brush. So you angulate your brush towards the gum.
Okay.
Because there's usually a space between the tooth and the gum.
Okay.
There's a pocket there. And that's where most of the dirt hides.
Okay.
So you angulate your brush at around 45 degrees, like that.
Yes.
And then you do circular motions. All right?
All right.
You do circular motions. The most important, the reason why I recommend that is some of the bristles, as you can see, will brush in between the gap between the tooth and the gum.
Okay.
And it will get out all those things. Okay. So you do that for the upper teeth. You also do the same for the lower teeth.
Yes.
So, of course, angulation for the lower teeth is downwards.
Okay.
Yeah?
Yes.
You brush like that. The same thing on the
other side.
On the other side,
yes.
That. Then now, still on the back teeth, now you brush
yes.
the biting surface where we have grooves.
All right.
So you make sure that now you brush each of the teeth, right?
Yes.
On all surfaces.
Okay.
On the inside, yes. the biting surface. Then where most people don't bother
yes.
is the inner part of the teeth.
All right.
All right? So on the inner part of the teeth, also do the same angulation and some strokes on the inner surface of the teeth on all sides. Then from there, we come to the front teeth.
Okay.
So for the front teeth, again, you can do the rolling motions, or you can even do the like strokings, vertical strokes.
All right.
On the teeth. Just make sure you don't use a lot of force.
Okay.
The reason why we don't recommend the horizontal strokes is that you'll be cutting across the gum.
Okay.
And the gum is soft tissue.
All right.
So sometimes you may find that if you use a lot of force over a long period of time, the gum starts to run away from the tooth. It's called gum recession.
Okay.
So it's usually because of the abrasion of the teeth.
All right.
Then, of course, once you finish with the outer surface of the front teeth, also again on the inner surface of the front teeth, both on the lower side and the upper side. From there, rinse your mouth. Okay.
All right.
So once you rinse your mouth, rinse your brush. Okay. Once you rinse your brush, now the other part that people forget, the tongue.
Okay.
You need to brush the tongue because also it gathers a lot of dirt.
True.
So you brush it. You can either use your brush or use something called a tongue scraper.
Okay.
And like we said, brushing basically is disintegrating the plaque or the food accumulation of food on the teeth. So it doesn't have to be a commercial brush. You can even use those twigs. So long as you are just cleaning, they are very effective.
All right.
So you don't have to give an excuse of that you can't afford a brush. But if even those zinaitangwa mswaki, zile za miti.
Mda.
Exactly. So those ones are also good because the whole point is to prevent formation of plaque and calculus on the teeth.
All right.
Yes.
We, wadau mmesikia, sisi tunaanzaga na meno za mbele. Amesema ndo za mwisho. Amesema is what you hizo ndo tunamaliza nazo. That is hiyo ni poa sana. So let me ask this, you would find someone that, well, they brush their teeth every day, but they still have bad breath, you know? Halitosis now.
Yes, yes.
You know, what would be causing that? Because you're brushing your teeth just like you've recommended.
Yes.
You're doing everything, but still you have bad breath.
All right, so that's a very important topic. In fact, it's one of the topics I've been told to talk about.
All right.
So halitosis is quite broad, and halitosis basically is bad breath over a long period of time.
Yes.
Despite brushing.
Okay.
Okay? So halitosis is basically chronic bad breath. So it means hata ukitumia mouthwash or you do whatever you're doing, it's just not helping. It's just helping for a short while, and then you go back to having bad breath. So there are many, I mean, it's different from the morning breath.
Okay.
There's something called the morning breath. Morning breath ni ile when you wake up in the morning and there is a particular smell that comes from the mouth, just as you wake up. But after, and we say the reason is, I mean, the mouth is just shut. You are not talking, you are not, doing anything with the mouth. So basically there'll be some breath that comes with it. But morning breath disappears after brushing.
Okay.
And when you start your day. But halitosis is chronic. It lingers even after brushing. So causes of halitosis, there are many causes, but broadly we can categorize them into 3.
Okay.
So number 1, it is caused by local factors. All right? So local factors means it's something that is happening within the mouth. And of course, this can be cavities, when you have cavities in your teeth. I mean, cavities hold food and all those things. So they'll definitely give you bad breath. Then you can have gum disease. So gum disease is where you have deep pockets. You remember those things that we said, the spaces between the tooth and the gum?
Yes.
They are supposed to be about 2 millimeters. Okay. But now when you have gum disease, those pockets become very deep.
All right.
So when they become deep, the bacteria have hiding places and some food debris inside there. So even if you brush, those bad breath bacteria will still continue hiding because the brush cannot reach underneath the gum.
Okay.
So you find now you will continue having that bad breath. So other things that happen in the mouth include, of course, poor oral hygiene. Some people don't brush their tongue. Also, we can have things happening at the back of the mouth, near the throat. So this include like tonsillitis.
All right.
There are people who have what we call tonsil stones. Like the tonsil produce some white stuff, which is very smelly. Yeah. So those can contribute to bad breath. So those are local factors. Basically, it's something happening around the mouth. Even ENT problems, ear, nose, and throat problems,
yes,
can, because the mouth and the nose are connected at the back. So those can also give you bad breath, especially in children.
All right.
The second cause of bad breath could be systemic diseases. So there are some conditions systemically which could be having that can contribute to bad breath. On top of my mind, I can think about diabetes. So there is something we call a ketone breath. It's specific for diabetic patients. They have a particular, kind of smell, right? Then the third cause is what we call psychological halitosis. Psychological halitosis is basically just as the word, psychological. So probably one day you woke up and you found that you have bad breath, or someone told you have bad breath. So that really hit you in your mind. And psychologically, you are always thinking you have bad breath.
Right.
And that is the worst, because then it affects even self-esteem. And you're being worried of something that probably that is not there. Yes.
But is it that you worry that you have it? Are you telling yourself you have bad breath?
Yes.
Or it is true you have that bad breath?
No, for psychological halitosis, most of the time they don't have bad breath. You might even find it is the morning after breath.
All right.
Or probably they met someone on their bad day, they had not brushed.
Okay.
So they were told, hey, maze, mdomo yako inanuka. So now that
it stays in your mind.
It stays in your mind, so you're always conscious. So, and differentiating between the three causes, of course, you have to visit a dentist for you to know what you're suffering from, and most of it is just treatable.
All right.
Because like if you have gum disease, you just do full mouth scaling and polishing and some medication, and you're good to go. If it's local factors, you need some of them. You just need to improve on your oral hygiene.
All right.
Yes.
You cannot say, let me use the word acquire.
Yes.
You cannot acquire it from someone else. That is, maybe you hang. It's not anything intimate.
Yes.
You just hang around this person.
Yeah.
Maybe you hang around a lot around this person.
Yeah.
There's no way you'd acquire it.
No, it's not contagious.
Oh.
It doesn't mean that now if you are staying with you now, I'll give you, bad breath. No.
It can't work.
No.
All right.
Yeah.
Amazing. So let me ask you something about brown teeth.
Yes.
All right. Because it's something that has been it's something that is being talked about now, in Nairobi.
Yes.
That you're seeing a lot of adverts about whitening teeth. Why do you think that? First of all, what causes that, and why is it now rampant in this town?
Yeah.
Yes.
That's a very good question, and it's something which is really close to me, because it's a problem that you are seeing most of the times now, and basically brown teeth. It's what you'd call dentofluorosis. Okay. So what is dentofluorosis or brown teeth? So dentofluorosis is it's an irreversible condition that affects the outer surfaces of the teeth because of ingestion, and the keyword here is ingestion, kumeza ama kukunywa.
Okay.
High fluoride levels at a specific time for a particular duration of time. All right?
Yes.
So most of the time it is caused by water, because most of the fluoride you find it in water. The reason why it is becoming very rampant, especially in Nairobi, we can only do a hypothesis of the fact that nowadays we have so many people who are settling in the peri-urban areas, all right? Unlike before. So before we used to have specific areas, Buru, some specific towns where even we had piped kanjo water,
yes,
right?
True, yes.
But nowadays, with the development, you find that so many estates are coming about in the peri-urban areas, and people are also very keen on building their houses in particular, areas in the outskirts of town.
Okay.
Unfortunately, the supply of water is not, developing at the same rate as the development of these buildings. So you find that most people are relying on borehole water, unlike before.
Yes.
So you find even these apartments that are being built, they have borehole water because city council water is not reliable. So they are using borehole water to supplement. Now, if you look at the geology of our region, we have a lot of fluoride in the stones, right? So if you go underground, it means that the water will have a lot of dissolved fluoride, all right? So now, when you take that water, you drink it, either drinking it directly or using it for cooking, then it means that you're going to be taking very high fluoride level, which will affect your teeth. And this dentofluorosis affects children from the ages of 0 up to around 12 years, because that's when the teeth are developing. And that's why we said it's an irreversible condition, because once teeth form, that's it. They don't regenerate. So once they form, and during the formation you have a lot of fluoride, it is going to be incorporated in the teeth, and the teeth will now start turning color. And on top of turning color, you find that they are also very weak. They easily break away. I think there is some pictures I had shared with you. You could probably show your viewers.
Yes. So
they start discoloring. They start becoming very weak and shedding off. And like you said, it's a very, very big problem which needs to be addressed. Right. In fact, we are saying it's an emerging public health concern, because there is a research that was done by the Ministry of Health in 2015. It's called the Kenya National Oral Health Survey. It showed, and remember this is 2015, it showed around 43% of school-going children had dental fluorosis in varying degrees.
All right.
Because remember, it can be from mild to severe. So mild is the one that you see the teeth look chalky white. You know, they look white, but it's not the normal white.
Right.
They might be having some strips or stripes of brown or yellow.
Okay.
And now the severe cases is where now you find the teeth are brown, you know, the outer surface is shelling off, and basically the teeth are just weak.
All right.
So indeed it is a big problem. We used to see it mostly in Nakuru and Naivasha,
Yes.
but now it is more in the urban areas
Okay.
of Nairobi and the surrounding regions.
Sawa.
Yes.
Because I asked that because I've seen it in children also, that the milk teeth will come out, and when the other tooth grows, it grows with the dental fluorosis.
Yes.
And once that happens, you say this is irreversible, but can it be whitened?
Yes. There are different options in terms of management, depending again with the age of the patient and also the severity of the disease. So some of the options available include professional whitening. Yes. And professional here is in capitals because we have so many unscrupulous people in this Nairobi. True. Yeah, that are
just
doing some crazy things in the name of whitening.
Yes.
So we can do bleaching in some of the mild to moderate cases.
Okay.
But in cases where the outer surface is totally shelling off, we do something called veneers.
All right.
So the veneers can either be direct veneers. This is like a filling to mask out the discoloration.
All right.
Remember, we said it is irreversible. So basically what you're doing is hiding, because part of the problems with dental fluorosis is mostly aesthetics. You find that someone cannot smile confidently. And also in severe cases, you find function. They cannot be able to eat properly because the teeth are weak and shelling off. So you mask out so that, you know, when you smile, no one sees the discoloration. So, but the most permanent option is basically to do something called the indirect veneers or crowns. So this is something like this. So it does two things. Of course, strengthens the tooth and also makes sure that you have the right color. Right? So like these are real crowns for a patient.
All right.
So as you can see, we've done on the front teeth.
Okay.
Because of course this is, like we said, it's an aesthetic concern, and most people are conscious of the way they look. And of course now once you do this, it also improves function because now the tooth is not shelling out.
Okay.
So this is a more permanent option.
Okay.
But then again, it shouldn't be done before someone is mature.
Okay.
Normally say around 17, 18 years.
All right.
Yes.
Oh, it's not recommended for children?
No, children, no, because their oral tissues are not fully developed.
All right.
Yeah, so around 17. So in younger children, you can do masking or other options.
All right.
Because this is a definitive treatment plan. Yes.
All right.
Yes.
There's something I've seen. Now, it's not I won't call it fluorosis, or you'd tell me if it is.
Yes.
The tooth does not turn brown.
Yes.
But you see, it has a black stain.
Yes.
Not the back teeth.
Yes.
Like you see, like the front teeth.
Yes.
Like inside the tooth, you can see a black stain. It's not broken or anything, but there's like a dot.
Yes.
A black one inside it.
Yes.
What causes that, and can that be removed?
Yeah, so it's mostly a clinical diagnosis, meaning that you really have to visit the dentist for it to be ascertained what it is. Because like we say, most of these stains are either yellow, brown, or black.
Yes.
And there are many different causes of that, because even when a cavity is starting, it starts as a black spot.
Okay.
All right, on the biting surface of the teeth. Then you also have stains, what we call extrinsic stains. Extrinsic stains are those stains that are caused by the food and the beverages that we take. So they just go and coat on the tooth. So it's not within the composition of the tooth, unlike fluorosis, because fluorosis is intrinsic, meaning it is a stain which is within the composition of the tooth. All right? But the other stains are usually extrinsic, meaning they're just on the outer surface of the tooth and they can be cleaned out. All right? So once you do the cleaning, then it can be, you know, the stain goes away.
Right.
If it's a cavity, once a filling is done, then you solve that problem. And if it is now fluorosis, then you manage it accordingly.
All right.
Yes.
Sawa sawa. Acha tusikie jumbani pia watu kwa maswali mingi sana kwako.
Yes.
Before we come back to hizi zingine hapa, si ndio?
That's fine.
All right. Tuliwaambia SMS number 22422. Swali yote uko nayo kwa daktari utume akujibu. Kama uko hapo mtaani na kuna issue imekusumbua na meno yako, this is your opportunity. Na mmezituma, acha tupitie 2 3, si ndio? We read like 3, you answer, then we read others, si ndio?
Yes.
All right. Yes. Okay. Tuko wapi? Hi Shatter. My daughter is 3 years old. Meno yake ya juu yameharibika yote. Wakati wa kung'oka yatang'oka kweli? All right. That's the first one. Nini inafanya meno inatoboka? Second question. Eliza, morning daktari. What causes the yellow color in teeth and can it be cleaned? All right. Haya, tujibu hizo kwanza.
Good.
Kuna mmoja wa kwanza amesema ako na 3-year-old daughter.
Yeah.
And her upper teeth are say spoiled.
Yeah.
So when it comes for the time to, I won't call them shading.
Yes.
But it's still milk teeth.
Yes.
Will it be an issue?
That's a good question, because ideally young children, really at 3 years, it is unfortunate to have cavities.
Okay.
Because those are, what is she saying, meno kutoboka. It is called early childhood caries. Okay. So caries basically ni hiyo anasema kutoboka meno. Right? So na kutoboka meno inaletangwa na poor oral hygiene. Okay? Because most people don't know that you are supposed to brush your children's teeth the moment they appear in the mouth. When they are even 6 months. You might not use a brush, but you are supposed to wipe them. Especially if you are breastfeeding or when they are taking milk with a bottle.
Okay.
Because that milk has a lot of sugars.
Yes.
Because like we said, dental cavities are caused by sugary food or food debris that is left on the teeth, acted on by bacteria, which produces some byproduct which now starts demineralizing the tooth.
Okay.
Naona meno iko na mineral, sa kutoa hiyo mineral. Yeah? So inatoboa shimo. So that is how cavities start. Okay. So it is important that, you know, we are here also to educate people on how they should take care of their teeth. The more, if you have a young baby and you are breastfeeding, please just immediately you finish breastfeeding, and especially if you are breastfeeding at night. You know, before they sleep, there is always some milk that is left in the mouth. And if you have, the baby has teeth, then that milk is going to act on those teeth and start developing cavities. So what you're supposed to do is the moment the baby sleeps, you just take a cotton or a cotton cloth, unaweka tu maji tu, then wipe those teeth. Just wipe those teeth. Okay. Then as they grow older and they start getting teeth, you just start introducing brushing pole pole, because the whole point is to disintegrate that formation of that layer, which now causes the teeth to decay.
All right.
So in terms of management, milk teeth are not supposed to be removed until the scheduled time, because zote zinakuanga na time yake ya kung'oka.
Okay.
So ifai kutolewa before, because zinakuanga na kazi ingine ya kupreserve your space for the permanent teeth.
Okay.
So it means if you lose them early, then those teeth that are coming to replace will find no space, and they might be crooked. So they are supposed to visit the dentist. If they have cavities, those cavities are supposed to be filled. Then once they are filled, hizo meno wakati yake ikifika ya kung'oka, zitang'oka tu kawaida. Okay. Yeah? But if you leave it like that, then it becomes a huge problem. Kwa sababu sasa the baby will not be able to feed, ataanza kuumwa na meno. It affects even nutrition, kwa sababu unaona kila kitu inapitanga kwa mdomo. Cool. So it is very important that they visit the dentist. Yes. And like we said, make sure you go to a qualified person. All right. Kwa sababu kuna places zingine utaenda tu ambiwa tu ni kung'olewa meno na I mean it's crazy.
True.
Yeah.
What would you say is the right time for the teeth, milk teeth, to start coming off?
Usually it's between 5 and 6 years.
Okay.
That's when the lower front teeth start shaking.
Okay.
Ideally, you should remove them at home.
Okay.
But there are those ones that you find they have, we call them over-retained. Inashake, alafu inakataa kuendelea kushake.
Okay.
Alafu with time unapata ingine imemea nyuma yake. So then it means you need to go and have it removed professionally.
Okay.
Yeah. So, but in terms of visiting the dentist, by the first birthday, the baby should visit a dentist.
All
right? Mostly nothing will be done, but at least they'll get acquainted with what happens at the dentist. And, you know, some of those problems can be picked early before it's too late.
Okay.
Yes.
But children don't like dentists, so you know.
No, it's because...
children have a phobia.
Yeah, it's because they always, like we said about oral health-seeking behavior, you know. So you find most people come when they're in pain, really. So what do you expect? They're already fearful because they're already in pain.
True.
But if that person comes when there is no pain and they get acquainted, because sometimes the fear is in the mind. I can tell you nowadays, we're able to practice painless dentistry.
All right.
All right? But the problem is those of us who can practice that are few compared to the quacks in this town. Yes, so now wanatuharibia.
All right. Right. I think it was Eliza. Eliza alikuwa ameuliza what causes the teeth to turn yellow.
Yes.
And there was another question, what causes cavities of the front teeth of young children and all teeth generally?
Yes.
What is the solution to tooth decay in children?
All right.
I think you had answered a part of it.
Yes.
But you can also touch on it again as you answer, Eliza.
Yeah, so the one that she had asked about discoloration of teeth, it's what I had said. There are two types, extrinsic and intrinsic. So extrinsic ni hii ya nje tu. So inaletangwa na food. So the food that we eat, the colored beverages and all those things that we take, if you don't brush properly, especially on the inside, it forms something called a plaque. Okay? Then the plaque hardens to become something called calculus or tartar. So once it becomes calculus or tartar, even if you brush, it cannot come out. So you're supposed to have it cleaned by the dentist. All right? So hiyo sasa ndio inasemangwa kuoshwa meno. Then we have the intrinsic stains. Intrinsic stains sasa ni vitu kama dental fluorosis. It is something that happens during the formation of the tooth. So it is something that you cannot wash out. Okay? Yeah. So the only thing you can do is mask the discoloration out. And I think it is important, Shata, we talk about prevention, right? Yes. Because sometimes we don't have to wait for the problem to happen. See, like the dental fluorosis, we've said it affects mothers or children from the time you're in your mother's womb up to around 12 years. Okay. So it means this, and we've said that it is caused by fluoride, high fluoride in water especially. And most people think it is just drinking water, but also the water used for cooking. If you just fetch water from borehole or whatever, and it has high fluoride content, then it will cause you to ingest high fluoride level. So what can we do? Number one, of course, is to ask the government to be more vigilant. As people are digging boreholes, we need to make sure that the water that is coming out of those boreholes is fit for human consumption. True. Because it's not just fluoride, because there are other heavy metals like mercury, lead, and all those things, other than just dental fluorosis, which is caused by high fluoride. Things like mercury and lead cause cancer, you know? So we just need to be more vigilant in terms of the water that is being consumed, and people need to regulate, the government needs to regulate the way the boreholes are being done in this town. All right. Secondly, we can use rainwater, harvesting rainwater. Because like we said, the reason why underground water has high fluoride and those have other heavy metals is because it passes through those rocks. And those rocks that have those high fluoride content, the fluoride gets dissolved in the water. Okay. So if you harvest rainwater, you are sure that, and you use it for cooking and drinking, then you are sure that you will not have that high fluoride. The borehole water, you can use it for doing other things, showering and all those other things. Okay. Number three, at a personal level, there is something we call household reverse osmosis machines. So these are machines that are installed in the kitchen. It doesn't matter whether it's your house or a rented house. You just install it under the kitchen. And what it does, it purifies the water, all right? No matter the source. Purifies the water. And most importantly, defluoridates that water. So it means it removes all the fluoride and other heavy metals that are there. So it is important that at a personal level, and these people who are building houses all over, if you dig a borehole, then you should at least install those reverse osmosis machines to make sure that the water that people are consuming is fit for consumption and it does not cause people such problems like dental fluorosis. And I have to insist here, it's not just any other filter, because there are so many filters in the market. Right. And most of them, what they do is they take dirty water, and here you'll have clean water. All right? So it just does like filtration, but it does not affect the mineral composition of that water. So if you had, kama ulikuwa na maji dirty water here, ukitumia hiyo mashini inakupatia maji safi. Lakini kama ilikuwa maji dirty iko na high fluoride, hapa itakuwa maji safi iko na high fluoride.
All right.
So that's why we are insisting it has to be a particular machine which has also reverse osmosis incorporated in it. That way at least you'll not even have to think about the water that you take in the household, and you'll be sure that your children will not be affected.
All right.
Yes.
Tusome tu maswali zingine zote, tujibu zile tutaweza, au sio?
Kabisa.
Alafu pia mimi niko na zile zangu, lazima tu nikuulize. Nataka kujua what causes sensitivity on teeth. Unapata meno ni very sensitive.
Yeah.
Mtu akigusa hivi chuma na ingine hivi unasikia una cringe. Unaona I'd like to know if that is also psychological, because it is external. But let us read the questions first. Yeah. Kuna mtu ameuliza, doctor, I have a tooth decay. Almost every teeth in my mouth. Nikikunywa anything moto au baridi na feel like mdomo inabomoka. Advise me on this. Right? That is sensitivity also. Morris from Homa Bay. I keep bleeding whenever I brush my teeth. How can I help this? Okay. Josiah Ongeri from Mtongwe. What causes the teeth to have some decay? Only on the grinding surface. Right. Stella from Nairobi. My teeth are sensitive. I can't chew anything on them. What can I do? Shida inakuanga gani? Meno ina turn brown and yet unasugua kila siku, alafu later ina fall. Right? Haya, harufu mbaya ya mdomo huwa inatokana na nini? Na kwa nini kwangu binafsi hiyo harufu mbaya imekataa kutoka na nimetumia madawa mingi? Right. Millie from Caries. Tell us dawa za kutake care our teeth. All right. Straight to the point, Millie there. What causes my gum to bleed at night? Okay. Kelvin Mbaya from Meru. What if I am using tobacco and my teeth have turned brown? I guess you should stop using it. Joyce from Naivasha. Doctor, they say cleaning teeth kwa hosi makes them weak. Do they become strong afterwards? All right. Haya. Joyce from Naivasha amesema cleaning teeth kwa hospitali makes them weak. Do they become stronger afterwards?
Good. So like you've seen, maswali ni mingi, masaa ni machache.
Ndio hiyo sasa.
So I think, we cannot tackle everything within an hour, but I'll just try to be very brief. So tuanze na gani hiyo sensitivity?
Juu kuna watu kama 4-3 wameuliza ku sensitivity, na mwingine amesema meno zina bleed, gums zina bleed at night. Right. So
sensitivity basically, I think kama alisikiliza tukianzia, tulipatia na structure ya meno venye inakuanga.
Okay.
So tulisema hii ya nje hapa hivi, enamel ni yenye tunaonanga, hii white yenye tunaonanga.
Yes.
So if there are 3 main causes of sensitivity. Number 1 is a cavity. So ukiwa na cavity kwa meno na imepita ile ya nje imefika kwa hii dentin. Hii yenye tunasema ya katikati. Remember we said this one is semi-living.
Okay.
So it's able to feel hot and cold things.
Okay.
Able to tell temperature changes. So kama uko na cavity kwa meno, na sometimes cavity zingine hazikuangi place unaweza ona. Zinakuanga katikati ya meno. So unakunywa unaangalia kwa kioo una cavity lakini ziko huko katikati ya meno. So kama uko na cavity inaweza kupatia sensitivity. Number 2, kuna kitu inaitangwa tooth surface loss. Tooth surface loss ni kumaanisha naona hii the protective outer layer of the tooth. Kuna wase pia ugrind meno sana. Usiku na nini. So when you grind teeth, it means the outer layer thins out. So ikithin out ina expose hii sensitive layer yenye tuliita dentin. Right? So when this layer is exposed by that, then you get sensitivity on teeth. The third cause, which is also common, is what we said, abrasion, because of using hard brush and wrong technique, and a lot of force. So when you use those horizontal strokes like this, so over time, gum, because gum haitakangi noma, inaondokeanga noma. So if there is any trauma to it, it will run away from the trauma. So when it does that, it exposes the roots. So ukiangalia meno unapata kuna ile meno ya white unaona, alafu kuna some yellow part which is down there. So when the gum runs away and exposes the root is usually very sensitive, because venye tunaona hapa, unaona root hainanga outer protective layer. Root is only made of dentin. So you can imagine if this gum goes down, it exposes the dentin. So that can also cause sensitivity. So kuna vitu tatu. Iyo nini cavities, when they have reached that middle layer called dentin, when the gum goes down and exposes the root, and also for those people who grind, when they lose the outer protective layer of the tooth, that can also cause sensitivity.
And what about the one I've asked you, that maybe chuma mbili zikiguarana hivi, una feel sensitive kwa meno? Is that psychological?
It's actually it is a phenomenon. The name of the phenomenon escapes my mind, but it is not something which is to do with your teeth, really.
All right.
Yes, but sometimes also when the dentin is exposed generally on the teeth, you know, it's like a hypersensitivity reaction.
All right.
Yes, you know, pain is a reflex. So sometimes ni meno zinajaribu kujiprotect.
Okay. Yeah. Kuna mwenye ameuliza gum zake zina bleeding usiku.
Yeah.
And what can they do? Na kuna mwingine amesema ametry ku treat halitosis. I work.
Exactly.
How would you advise such people?
So gum basically is in a bleeding juu ya hiyo gum disease. Like we said, there is usually a space between, hii space inakuanga hapa hivi, between meno na gum. Kuna space hapo hivyo. So inafaa kuwa, it's a pocket. We actually call it a pocket. So hiyo pocket, if you're just brushing your teeth here, all right, and not touching, so inamaanisha kuna food zenye zinabakingi huku. So when tumesema gum does not like trauma or anything. So the moment now this food packs here, this gum starts getting inflamed.
Okay.
All right? So it gets reddish and inflamed. So the moment you eat, if the disease is so advanced, if you eat or even brush, because this gum is really inflamed, inakaa red, kitu tu ikipita tu hapo inaanza kubleed. So what needs to be done is, aende hospitali, afanywe gum treatment. So it is basically removing all the debris and the bacteria that are inside there. And that can also be causing the halitosis. Because ukiona gum disease, kuna venye tu meno zako zitanuka vibaya sana. So hata ukibrush bado, huwezi fikia huko ndani, pali kwa hiyo pocket. Brush haiwezi fika huko. So hizo bacteria bado ziko huko ndani, na you will still continue experiencing bad breath.
So what's the treatment?
Treatment is they go to hospital for some, to a qualified,
qualified.
Unaenda tu, and I always say, sometimes Kenyans will love private so much. If you do not have money for a good private clinic and a competent doctor, please just go to a public hospital. You know, most level 4s and level 5s and 6, they have functional dental departments, and those that are not functional, we really call upon the county governments. I mean, oral health is has been neglected for some time. They really need to invest in making sure that we have functional facilities, especially with the UHC, this universal health care coverage. Because some of these problems we have in the body, they come from the mouth. So we just need to also incorporate oral health care in the UHC. Right? So they just go to a qualified, they'll do something we call full mouth scaling and polishing. And in some severe cases, they have to do what we call periodontal surgery. So basically, it's where they cut the gum, expose, so that they're able to clean all those bacteria and everything, and then now they stitch it back. So that will sort out that problem.
All right.
Yes.
So, kama una watch, mambo uende hosi. Kama una pesa ya kwenda very expensive private hospital, not expensive, a qualified one, enda kwa ya serikali. Umesema level 5 and 6?
Yes.
All right.
Yes.
Enda usiagava uangaliwe. Juu usikae home unaogopaga kutoka, unajiambia unajua nikiongea. Because hii dunia kama your self esteem iko huku chini, well, it's hard to achieve anything really. Si ndio? You need your confidence out there and up there kufanya hizi vitu. As we continue, doctor, ushaona meno ya mtu imebreak? Like meno haing'oki, inavunjika.
Yes.
What causes that? Na hajagongwa, meno but unapata meno imebreak.
Yeah.
Yes.
So two things. Number one, ni hiyo two cavities. So sometimes, like we said, when you get a cavity, inaanzanga tu ikiwa kitu kidogo hapa hivi nje. The reason why it starts as a small cavity on the outside is because ile ya nje is the hardest part of the body.
Yes.
So it's usually very tough, even for the bacteria and those demineralizing things to demineralize. But the moment it reaches the inner surface, it actually now fans out because the inner surface is very soft. All right? So unapata, the cavity on the outside is small, but on the inside it is fanning out. It is very big. So when all this layer is destroyed, so what you're left with is a shell of a tooth.
Okay.
So the moment sasa unauma kitu, since it is not supported on the inside, it just collapses.
Okay.
And that's how teeth break. So someone will come and tell you, my tooth has broken. It's not like it has really broken. The tooth is sick.
All right.
It is just that that is what now we call a cavity.
Okay.
Cavitation. So kashimo kadogo, and then sasa inapasuka inakuwa shimo kubwa.
All right.
So that is the cause. It's caused by dental caries or dental decay.
Okay.
All right? The other cause is usually mostly after, and I think it's important to mention the difference between when you can do, I've seen someone asking, a root canal and when do you do a filling?
Yes.
Because most people think it is an either or situation.
Yes.
No, it is not. It is actually a clinical decision. So tulisema, the moment cavity iko hapa, ama hapa,
Yes.
hapo sasa unaweza fanya filling.
Okay.
Because hiyo infection ijafika kwa the engine of the tooth.
Okay.
So ukienda kwa hosi, na mostly hata unaweza jua, hiyo meno ikuangi inauma. Ni ile tu iko sensitive. So unaenda, unapata iko hapa ama hapa. It's usually the best time.
Okay.
Unaenda, unafanyiwa filling. Na inakuwa sawa.
Okay.
Right?
Filling ni inajazwa? Inajazwa.
So basically hiyo place imeoza, ni kama barabara.
Okay.
Pothole. Kuna pothole. So inaendanga, inachongwa, inatolewa hiyo kitu yote imeoza, alafu sasa inaekelewa kitu ingine.
Okay.
So that is what now we call a filling.
Filling.
The problem now comes in when now you go, kama sisi wa Kenya venye tumezoea, kwendanga when it's too late.
When it's too late, ile kimeumana.
Literally. Uchungu, umefura. Yes. So by that time inamaanishanga hiyo infection. Because dental caries or dental cavity, it is actually an infection.
Yes.
So hiyo infection ikiwa imekula hapa na hapa, sasa hapo hivyo inaweza tolewa na ifiliwe.
Okay.
Lakini the moment imefika sasa hapa ndani, pain. Uwezi lala usiku. Yeah? A lot of pain.
Mbona meno uma usiku?
Good question.
Mchana uko tupo. Usiku.
Najua, tooth is like an end organ. Inakuanga huko mwisho wa blood supply. You get? So when you are standing, the heart is the one that is pumping blood up. Najua meno ziko side ya juu. Heart iko hapa, so meno iko juu.
Okay.
So it is pumping blood up. You know? So but now when you lie flat, damu inaingia kule na gravity. Right? So inateremka ina gash. And that's why most people tell you, maze nasikia kaa roho inapigia kwa meno. It's because now, as you've seen, there are blood vessels inside here.
Yes.
So now on top of the heart pumping, you're also lying flat. So the blood inakuja kukuja.
All right.
So it is now, and the inflammation inside here is just too much. Right? So that is why we advise, usiku kama unaumwa meno, ukiamka tu uanze kutembea, at least in a relax. Yeah. So we tell people, at least before you go to the dentist, you can sleep propped up. Either ukae chini, lakini ukilala flat, itakuwa too much. So sasa hiyo uko na hiyo pain, two things, hiyo infection imefika kwa nerves. All right? So what you're supposed to do is unaenda unafanywa root canal. Root canal basically means removing these nerves.
Okay.
Because unaona kuna main nerve yenye inatokanga kwa brain, inakuja kama inapatia every tooth a branch.
A signal,
yeah, inakuja inapatia a branch like that. Yes. So basically root canal is removing these infected nerves all the way to the tip there.
Okay.
So basically you are disconnecting this tooth from blood supply and from the nerves. So that is when that is what we call a root canal treatment.
All right.
Na pia it's a very delicate procedure, so it needs to be done properly. If done properly, that tooth will not pain.
Okay.
Sometimes if it's not done properly, you'll find that it still continues paining.
Okay.
Yeah.
Asante sana daktari. At least tumedemystify vitu kadhaa.
Kabisa.
Ya kwanza tumejua dawa ya meno sio kung'oa.
Kabisa.
Number 1, hiyo tunaambiananga dawa ya meno ni kung'oa. Mmejua, so kama uko na issue kama hiyo unafaa unaenda hosi unaangaliwa. Na uzuri ni ati hakuna kitu nimesikia daktari amesema haina tiba. In regard to meno, to halitosis, zote zinatibiwa, si ndio? So if you have an issue that has been persistent in your life, go get it checked out. Au sio? Doc, how do you get you on your social media handles?
Just PJ Muriuki, everywhere.
All right.
On Facebook, on Twitter, it's Dr. PJ Muriuki.
Okay.
Yeah. Social media zote, hadi Twitter.
Unajibungi DM kama mtu ako na issue nyingine hapa amesikia na anataka further clarification, reach out.
Yeah, tunaangalianga of course when we get time.
All right.
We check.
Yes.
But we can also, share a contact that if someone wants to reach out, they can always reach out.
Okay.
Yeah, and we'll see the best way we can help them.
Sawa. Yes. Asante sana daktari for your time.
Karibu sana.
Si ndio?
Yes.
Amazing. Wadau, imekuwa amazing. Au sio? Mumelala thing or true? Meno ikipiga sana usiku kama umelala amka uanze kutembea. Hiyo ni melana saa hii. Anyway, we meet tomorrow tukipika. Sawa. Amazingness. Thank you for your time. Do have a blessed day. Amka ujitume. Muola. Hapo sawa.